Good morning, everyone. Thank you for joining us today to discuss the CMS Resource Medicare Coverage Database. My name is Karen Curtis, and I am a Provider Outreach and Education Specialist here at WPS. Today, I am joined by Bailey Lawson. She is a coworker and friend. Bailey will be helping me today by providing assistance when needed and letting me know what questions you've added to the chat. I have just a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and you would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center. Here you can also find a list of our upcoming events. Bailey will add a link in the chat to get you there quickly. Our training center also contains a webpage for our encore presentations. Videos are available for up to 90 days, and they can be watched on our webpage without you having to go to YouTube. We know that some of you may not be able to access YouTube from your company computer, and we want you to be able to receive the education that you're interested in. Each encore is posted with a link that will allow you to download copies of the presentation. You will also be given a chance to complete a survey and provide feedback on those encores. Today's presentation is being recorded, and as long as there are no technical issues, then this will be posted to our website within the next week or so. Later, there will be a question and answer session if time permits. If you have any questions related to today's topic, please send those using the chat feature. If there are any questions that I don't get to, or if some require additional research, an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in the presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what we're doing right. Let us know if you feel that there's areas that we can improve. It also gives you an opportunity to give us input on what types of education you'd like to see in the future. While this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Now here at WPS, we do our best to provide you with accurate, up-to-date education. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and federal regulations will take priority over anything presented today. I also need to let you know that CMS does prohibit the recording of this webinar. We are recording the event so it could be posted to our encore presentation webpage and YouTube channel. So it's going to be available if there's something you missed, if you want to come back and reference it for some reason, or if there's information that you'd like to share. This morning, I will be telling you a little bit about the Medicare coverage database and its benefits before we go out to the CMS website and navigate and take a look around. The Medicare coverage database is a searchable repository that provides comprehensive information related to what is covered and what is not covered by fee-for-service Medicare. It contains a variety of coverage-related documents that range from national to local guidelines, finalized, proposed, and draft editions. The information found in the database is updated on a regular basis. The national coverage information is updated in real time, while the local coverage data is captured on Sunday night at midnight, and any updates will be displayed the following Thursday. National and local coverage download files are also updated every Thursday. Now, I mentioned that there's a variety of different coverage-related documents located within the database, but let's get more specific. National Coverage Determination, or NCD, is a decision made by CMS that determines whether a specific medical service, procedure, or technology is considered reasonable and necessary. These are going to apply to all MACs. Give me just 1 second, please. Sorry about that. National Coverage Analysis is a collection of documents that support the new review or a reconsideration of an NCD. Local coverage determinations are guidelines developed by MACs that determine coverage criteria for a specific item or service. These can be created when there is no existing NCD related to an item or service, or if the MAC feels that the NCD needs to be further defined. A proposed local coverage determination is considered a draft, and it will go through a period for public comment before it becomes final. Local coverage articles are published by a MAC to provide guidelines or education to the provider community, and they are related to an existing LCD. Draft articles are written to support a proposed LCD. Once the proposed LCD becomes final, a billing and coding article will replace the draft. Coding analysis for labs is a process for making changes to the coding component of the negotiated laboratory NCDs. The Medical Evidence Development and Coverage Advisory Committee reviews and evaluates medical literature, reviews technology assessments, public testimony, and examines data and information on the benefits, harms, and appropriateness of medical items and services that are covered under Medicare or that may be eligible for coverage. Finally, the technical assessments support individual NCDs and focuses on the quality of the evidence for a given technology. Now, everyone has access to the Medicare coverage database. Healthcare providers and professionals can benefit by knowing Medicare coverage before providing services or items to patients. This allows providers to provide patients with a written advance notice before billing Medicare. MACs can use these database to determine coverage for policies and claims processing. Beneficiaries can look if a recommended item or service will be covered by Medicare. If a service is denied, they may be able to find additional information that will explain the reason for the denial. So what are the benefits of using the Medicare coverage database? Well, you'll be able to look at all the NCDs and LCDs in one place. The NCDs are updated in real time. The LCDs are updated weekly, so you know that you're always getting the most up-to-date information. It also allows providers to prepare advanced beneficiary notices if needed. If the patient isn't given enough notice and the item or service is denied, then the provider can be financially liable. But if you're able to give that advance notice and the item or service is not covered, then Medicare may hold the patient liable. So this could be beneficial to the provider. There are many options that you can search and access with the information found in the Medicare coverage database. We are going to take a look at each of these options in a little more detail. Now, the search function allows you to look up documents using keywords, CPT, HCPCS, ICD-10, and document IDs. You can even search by MAC to see if it applies specifically to WPS. Search results can then be further defined by selecting document type, specific states or specific contractors. If the document lists a CPT code, then the user agreement will have to be accepted before the document is displayed. This is going to include the American Medical Association, the American Dental Association, and the National Uniform Billing Committee. This action will only need to be accepted once per web session. This may be something that you've noticed at the beginning of WPS webinars. I know that when I hold my preventive services webinars, because I list CPT codes or because I discuss like type of bills and things that would be included on a UB04, we have to show these same disclaimers and user agreements. Now, when looking for new changes, the best way to search is going to be by the document number, and this is going to give you the best results. But you can also sort your searches by last updated, and we'll take a look at that in a few minutes. Now, there are quite a few options when it comes to reports. You can view national or local coverage. There is a What's New report that will let you select a time frame from the last 7 days to the last 120 days. There's also a column that will tell you what has changed within the document and if the update resulted in policy changes. Under local, you will find a self-administered drug exclusion list report. This report lists drugs determined by the contractor to be usually self-administered and therefore excluded from Medicare Part B coverage by law. You can select to view data by current in effect, selected date, or a selected date range. You can also choose a specific MAC, or you can view all contractors. There's also optional boxes to enter a code or a keyword. The reports page also has an option to view the contractor medical director for each MAC by jurisdiction. There's some contact information that we'll take a look at when we're out there. Now, the website also has downloadable data sets for LCDs, articles, and NCDs. Each download is a zip package which contains a README file, a data set, and an associated data dictionary. The data dictionary is going to explain the content of the individual files. I have downloaded the file for the current LCD so that you can see what it looks like, and we will take a look at that during the navigation portion of the webinar. Remember that LCDs are updated weekly and the NCDs are updated in real time. So any information in these data sets could be outdated rather quickly. There are a few other options that we'll take a look at today. There's the basket function. This allows you to save documents as you're searching the database. After entering your search, a list of documents that meet your criteria will appear. The last column on the right is going to contain a basket. And if you find a document that you want to save, then you can click on that basket and it'll turn from from gray to blue, so you'll know which documents you saved and which ones you haven't. And a number is going to appear on a basket icon in the header. And once you finish, then you can click on that basket to view your saved documents. You will also have the option to email the documents or create a link. Archive takes you to the Medicare coverage database, from the Medicare coverage database to the archive Medicare coverage database. Here's where you can search retired LCDs and articles. The archive database also has a reports option, so it lets you download reports from there. The home page also has a notice board where CMS will post updates. There is a beneficiary section. Here, patients can find a link to a guide which would help them navigating the Medicare coverage database. CMS has also provided links to Medicare.gov, which is the website that is created for beneficiaries. This website is where patients can find the Medicare and You handbook. There's also a link that will help them find a Medicare provider near them. Lastly is the public comments section, where you can find a link to items open for public comments. Now, this picture is a link to the CMS.gov website, but once you go out there, what we're going to do, I wanted to at least show you so you had the navigation process that you could refer back to. You're going to click on Medicare, then coverage, and then you're going to see the Medicare coverage database. So let's go out there and take a look. Okay, so here I'm going to click on Medicare coverage, Medicare coverage database. So here's the home page for the Medicare coverage database. Along the top, you'll see that there's the search, reports, and download functions. The basket is currently showing 0 documents. The question mark with the circle, this is for help functions. Now, if I click on the question mark, it's going to give you the option to visit the help and resources page, page help. You can take a tour of the search and the reports features, or the contact us, which will take you to some FAQs, which also includes an email link to CMS. So I want to show you real quick the help and resources. So here you can find the latest updates. It tells you here that the latest help and resources, it updated the how to downloads presentation to include an introductory page. There's another link for the notice board. The how to takes you to a library. This right here is a Medicare Learning Network educational tool. And it's going to take you to some instructions on how to use the Medicare coverage database. So you can read through this. It gives you some more help. These other ones are PDFs, but they're presentations. So like it tells you how to search and kind of walks you through that. So that's another thing that could be helpful if you need to look at those. The MCD data schedule, this shows you that the NCDs are current. The schedule for LCDs and downloads shows that the information was last captured on Sunday, March 30th, and was updated on Thursday, April 3rd. So following the proposed schedule, the database should be updated tomorrow, since that's Thursday, and it's going to have data that was captured through Sunday, April 6th. The MCD archive provides the schedule for the archive database. Here you can see proposed LCDs, retired LCDs, and articles along with superseding versions of active LCDs and articles. These are all moved to the archive database after 1 year. It does have the ICD-9 LCDs and articles. ICD-9 was replaced by ICD-10 in 2015, so all of that information can also be found on the archive database. Related links provide you with additional resources related to the Medicare coverage database. The MCD versus Medicare government, this explains that the database is geared more towards MACs and providers, while the Medicare.gov website is geared more towards beneficiaries. It also has a link there for beneficiaries. Local coverage info provides you with resources related to LCDs and MACs. You can also find a coverage document, descriptions document, and this goes through, it's kind of small here. Let me get this a little bigger for you. This goes through the different documents, the types of documents that can be found within the database, and it explains what they are. So it tells you the difference between an LCD and an article. We can scroll down, gives you the NCDs, and then it goes into the other ones that maybe aren't used as much. I guess it probably depends on what type of facility you are, but just kind of gives you an explanation of all those different document types. Down at the very bottom here, you have a link where you could submit feedback or ask a question. I'm going to go back to the home page. This little settings button here, you can reset search data. The archive is going to take you to the archive database. So you can see this looks a lot like the Medicare coverage database. It is the archives. There isn't a download option, but there is a search and reports. There's also the notice board and more information, so you can go find information on here. This also has the basket option, so you can save documents that you find on the archive database to your basket, and then you can either email those, or I'm sorry, you can email those to yourself or to someone else. The last link here is for an application program interface. This is something that I am not familiar with, so I am not going to try to attempt to discuss it, but I do want to let you know that it is available. It's designed for developers to access the information where it can kind of share in between software. But that is out there in case anybody is interested in that. Now you'll see here the notice board provides updates. It makes you aware of changes that were made to the database. You can tell, I mean, there aren't a ton of updates. They're not making a bunch of changes out here. The last one was, go to the latest site updates, was the one that we looked at earlier. In the middle is the link that we talked about for the different beneficiaries. They can get information on how to use the database. There's the Medicare.gov. Public's comments section is going to give you links to documents that are currently accepting comments from the public. So if that's something that you're interested in, you have the option there to submit a comment if you'd like. Now, because there's so much to show in the search function, I want to quickly look at the downloads and the reports. Here was the licensure agreement that we talked about. That's going to pop up. We'll just accept that. So here you can see your options. There's the current LCDs, current retired, current articles. I did download a copy, so let me show you. It does go into a zip file. So when you originally download it, it's going to look like this. You do have the LCD data directory, which I also downloaded. So here it goes through, let me show you this first. It talks about the different files. When you click on this zip file, it's going to look like this. So here's all the options that you have for what you can download. And what this data dictionary does is go through these and explain what the information is. So it tells you the information in the table and what that means. I tried to download one of these and it took some time, so I don't want to do that to you guys, but that is available out there if that's something that you want to look at. Again, remember that this information is updated weekly, so it could go out of date rather quickly. It does tell you that the data is as of 3/30 and that it was released out here on 4/3. I'm going to go over and look at the reports. So I just clicked on reports and you can see there's quite a few to choose from. It is broken down from national coverage to local coverage. The what's new, we're just going to do all documents. You can narrow down the results to look for a specific document type. You can also change the time frame. So down here, you can get updates within the last 7 days, or you can go up to 120 days. We'll just look at the last 7. Nope, it did 30. So this gives you when it was last updated. It gives you the type of document it is, the title. Here's the ID. So like for these, it gives you the NCD number, and it tells you what's been updated. So this updated NCD coding via a new change request or transmittal, no policy changes were made. And since there is the basket here, let me show you that. It does, you have a total, so there's 13 documents that were updated within the last 7 days. If I find one that our document that I'm interested in, I can click on the bucket. It tells me it was added. The bucket turns blue. There's also a number 1 up here. So that lets me know that it was saved. If I go down, I'm just going to click a few things just so you can see how this works. Now have 3 documents in my basket. I have the option to delete all of them or delete a single one if I don't want it in there anymore. I can also email the basket. So you can enter that information and send it to myself or somebody else. I can also create a link. So it's going to give me a URL and I can share that with people. I'm going to empty this out. Excuse me. Go back. Here, the National Coverage Annual Report. Again, you can narrow it down or you can just click on all documents. Here, this is going to show you all NCDs, NCAs, and CALs that were created or updated within a specific calendar year. So you can see here up on the left, you can change that calendar year depending on what you're looking for. So again, that's going to be things that have been updated or changed. If I scroll down to the very bottom here, here is the local coverage, the self-administered drug exclusion list that I had mentioned earlier. You can see that you can choose different date criteria and contractors. The HCPC or CPTs is optional along with the drug keyword. If I just do currently effective, I'm going to choose WPS. So here we get a list of all of the drugs that we consider self-administered. It does provide links to the articles. So if you want to get some more information, you can click on that link and it'll take you to the article. You can then go back to the list. Down at the bottom here, you'll notice you can download the list to an Excel spreadsheet if that's something that you would like to do. Go back up. The last report I wanted to show you was the local coverage MAC contacts report. So again, you see it can be filtered by contract, contractor, state. Again, I'm just going to click on WPS. I can click a jurisdiction number if I would like, but we're just going to look at all of them. So then it goes and it lists the contractor number. There is a PO box. It tells you who the CMD is, the contractor medical director, and gives you a link to our website for contact information. Over here it has the states that they're covered. So you can see some of these they broke down. This would be for our J5 national contract. Just some information there if you need to contact one of our CMDs. Now I'm going to take you to the search function. I had mentioned earlier that the search function allows you to look up documents using key codes, CPT, HCPC, diagnosis, any of that. Now remember, when looking for new changes, then your best option would be to search by the document number, but of course you would have to have that in order to look for updates. I'm going to search by keyword. So here it provided me with 649 results. This is broken down by results where diabetes was in the title versus when it searched the entire document to find diabetes. Over here, if I scroll down, you can see that it breaks it into the type of documents and how many results there are for each one of those. Again, here you can also download this to an Excel spreadsheet if that's something that you want to do. That way you would have document numbers. It does provide links to the documents. Go back to the search results here. And the results, I could filter these down if I wanted to do different document types, if I wanted to look by different state contractors. So again, I can break all of this down. It really just depends on what you're looking for. If I click on the More button here, these options right here, you can see it's only for local coverage, but it gives you the option where you can enter a specific procedure code. You can do a procedure code range, same with diagnosis codes, dates. I can do last update, currently effective. So you can really narrow things down to get to find the information that you want. Now I am going to ask Bailey, have we gotten anything that's come in through the chat? Is there anything that people are looking for?
No, nothing has come through the chat, Karen.
Okay. Hopefully that provided you guys with some really good information that I hope that you can take back and use to find those documents that you're looking for. Now, after the close of today's webinar, you should receive a thank you for attending email. And here's where you're going to find your proof of attendance and contact hours for continuing education units. This email also contains a link which gives you another opportunity to provide us feedback. If you don't get this email, then please check your spam or your junk folders. You will also need to add messenger@webex.com to your safe sender list, and that way you won't have issues in the future when you're attending webinars. Now, if you joined only by phone, you are not going to receive this email. So in that case, please send an email to the education mailbox, include your name and your phone number that you used to join, and we can email a certificate to you so that that can be sent in for continuing education units. If you do think of any questions after the webinar, you do have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff knows that your question is related to this webinar and they'll send it directly to me. Now, if you have anything specific, like I looked up an LCD and it gave this information, but my claim didn't process according to the information in the LCD, those would need to go to customer service. They have the access, or they have access to the system, and they can look up your claim and give you an answer based on how that claim processed. Now, when you disconnect from the webinar, you will be directed to a CMS survey. I'm also having Bailey add a link into the chat. Your feedback really does mean a lot to us. We know that everybody out there is asking you to complete surveys and that it does take time. So we do appreciate when you take the time to do that. But we do review what you have to say. We do our best to make the changes that you ask for. And this, again, is also your opportunity to let us know what topics you would like to see us provide education on in the future. So if you have something specific, we would love to hear it. Also, if you have ideas that you think would improve how you receive your education, be sure to tell us that too. The redirect is going to look what you see right here in the middle. We don't have any control over how this appears, so we just want to let you know that this isn't spam. It isn't anything malicious. It is, you can see in the destination, it does say CMS. It is their Qualtrics survey. Also, if you're watching this as an encore, there will be a pop-up box and the online survey is going to look like this. If you click on that, you can take the survey for the encore. That brings us to the end of today's presentation. On behalf of myself, Bailey, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.